from Big Sky Medical Center, Taylor Rose. He joined us on our first couple episodes 8 weeks ago. It's hard to imagine that much time has flown by when this first hit Big Sky like a light switch. And so I wanted to bring Taylor back to do a little look back over the last 8 weeks, how Big Sky Medical Center's fared and thoughts on that. So Taylor, welcome back.
Thanks, Eric. I appreciate it.
So I guess let me start with that. Looking back over the last 8 weeks, what are some of the more standout moments for you or lessons learned, not only for yourself, but also for the medical center?
Yeah, it's been an interesting 8 weeks. I actually showed up to Big Sky about a week before this COVID thing hit, and just the impact and how fast it hit was just pretty astounding to me. But on the flip side, everybody who here at the hospital especially, and all the support from the community, how fast people reacted. I got multiple calls around the community from people asking just the question, what can I do? And how can I help? And just seeing the community rally up and around us together. And it wasn't just a quick bolus of support. It was this ongoing thing. And many people in the community reached out and they've supported us. And, our workforce, they canceled vacations, they canceled their personal plans to make sure they were available in case any kind of surge were to hit us. So our nurses, they were basically ready and waiting for any kind of potential big influx of patients that we were to see. So it's been impressive to me to see how much, where we started, it was something completely new. As Matt Kelly mentioned earlier, this is something that we've never seen before. We've never had to deal with this. This is a once in a lifetime kind of type pandemic that we're dealing with. But the ability for, our hospital staff and the community to rally around and really address these needs. And it's just been impressive to me so far.
Yeah. No, there was a heck of a community rally there at the beginning. I remember 8 weeks ago, we were talking about some of the efforts, like the construction crews literally showed up at your doorstep to help you guys build out a couple more rooms. Did that project get finished? Did those rooms ever get put to use?
Yeah, it's a great timing on that, because this last week we had our final construction walkthrough where we were just telling them, you missed a little paint chip there and a few things, just making sure it's all up to speed. So last week that construction project did finalize. We're just waiting to get a few occupancy permitting type things going. But if we were to get a huge influx of patients here at Big Sky Medical Center today, we'd have somewhere to put those patients now. And we'd have, those rooms fully equipped with medical gases and everything that we'd need to take care of them. I've never in my entire career seen any project happen that fast on that big of a scale. And you talk about the initial support, but I'm still seeing support. I walked into work today and I looked down at the ground, and a lot of the people in the Big Sky community, they've gone and they've done the chalk art on our patios, and just thanking the workers that work here at Big Sky Medical Center. And so it's just a continual thing. It wasn't a flashbang type thing, but this ongoing continual support has been incredible.
Yeah, well, I guess if there's a silver lining, we certainly got the hospital even to a higher level of service and availability for if there was that surge. Where does the hospital stand in terms of operations now? I know we've kind of gone through the spectrum where normal care was kind of pushed to the side to make priority for COVID. So talking to your audience now, I guess, where do we stand with COVID and now getting back to some normal business practices? What can people expect there, or services that are available?
Yeah, Big Sky Medical Center, we never turned down any service, or we didn't, stop doing any kind of service here at Big Sky Medical Center. All of the clinic was still open and running with some altered operations from the get-go. And over time, we've refined those a little bit to address the needs of COVID. And we've actually increased our services that we've been offering, partitioned them out a little bit. Right now, current operations that we have going is obviously the emergency department up and running. Our inpatient service is still up and running. Then we have the clinic that is still going and we're seeing patients. That has shifted a little bit though, to where we're trying to push a little bit more remote video kind of type visits, those telemedicine visits that you've heard about. And if you are coming in to be seen by a doctor, you'll be screened when you come in. You'll have your temperature taken. You'll be asked some questions about some of your history, potential risk for COVID. You'll be asked to wear a mask if you're on site at all. Well, not a mask, it's just a face covering. So if you are planning to visit the hospital, please do bring your own face covering. We have some available, but we're trying to conserve our personal protective equipment for, the really dire needs. But and then we also have some visitor restrictions in place. Unfortunately, we're trying to reduce the transmission of any kind of disease, especially COVID. But that basically boils down to we don't allow visitors in the hospital unless there's a pediatric patient, a child, or for some compassionate type care. So if there was somebody with some dementia or somebody with some personal needs that they had to have somebody there with them. So there are some unfortunate side effects to this with the visitors. We are seeing all of our COVID or respiratory risk patients in what we're calling the viral triage clinic. And so if you come to the hospital and you're seen and you do screen positive for some of those questions, you'll be seen in a separate part of the facility that's got its own complete separate entrance. You're completely isolated from anybody else in the building, and you'll be taken care of in that area. We also offer drive-through COVID testing. So as the senator mentioned earlier, there is some guidelines around who can be tested, but you can always call the COVID hotline for Bozeman Health, and they can recommend you for testing if you qualify, or your doctor can write an order for your testing. And then all you have to do is drive up through our ED ambulance bay. We walk out to you. You don't even have to come into the hospital or the facility at all, and we just take care of you. We swab you, and you get your test back within about 48 hours at this point.
Okay. So there is testing if you qualify. How about antibody testing? Any talk about that, or when that might become available through your system?
Yeah, we're actively investigating that and researching it. There's a lot, and it's not just locally that we need to do more research about this. This is on a national level. We don't know the impact that the antibody testing actually has. There's so many unknowns when it comes to this, as both Matt Kelly and the senator have talked about earlier. We don't know the ability to predict somebody's immunity based on their having antibodies to COVID-19. So we're actively researching that part of it, but we are looking at the future of antibody testing and what it can do for Bozeman Health and the community that we serve.
Will Big Sky Medical play a role with, as Matt was talking about, some of the concerns around the park opening in West Yellowstone? I mean, will your facilities play a role in helping help people there, especially if some of those small communities, some of those gateway communities have some breakouts?
Absolutely. We're in active discussions with the CHP clinic that's out there, the Community Health Partners Clinic. I'm traveling out to West Yellowstone this Wednesday to talk to some of the people out there to see how Bozeman Health can support them out there. Right now, we don't know what that looks like. We are there as support. We have put up many testing sites for Bozeman Health. We have stood them up. We know what is involved and what is needed to do the testing for COVID-19. And there are a lot of smaller communities like West Yellowstone that have not been able to do that. And so we're right now lending our expertise and being, subject matter experts in the COVID-19 testing process, seeing how we can support them and help them. But we are actively in discussions with them, trying to help them out. And as Big Sky Medical Center receives about 80% of the patients coming out of West Yellowstone, we have a very large vested interest in making sure they are equipped to handle any kind of influx in patients that they would see when the park reopens.
Yeah. Well, that's good to know you guys will be playing a role there. Well, Taylor, 8 weeks later, anything else you'd like to add or any requests of the community? We asked this the first 2 times you were on, and you had some great answers, and I hopefully the community listened, but any requests of the community moving forward or any needs that you guys need addressed?
Yeah, I would just say that we want people to come and be cared for if they need care. A lot of people are scared to come to hospitals because of COVID-19. They're worried that they're going to catch it because they're coming to a hospital. And I believe that there's been a stigma out in the community to stay away from the hospital. And we're seeing an increased number of visits that are due to people waiting too long to come and get care. So we would just say that we are open. We are here to serve your needs. Please come if you feel like you need to be seen. And also, Bozeman Health in general, we're restarting and reopening. We're in our next phase of the COVID-19 preparedness, and we're making sure that our employees are safe, that we're taking precautions to not overly consume our PPE supply, but we are slowly ramping back up the procedures that were considered non-essential before. And there is a backlog of that, and we're trying to catch up, and we're actively trying to support the health needs of the community. Because just because COVID's here doesn't mean we're not going to have a gallbladder that's going out. And so we need to be able to take care of those people and be able to support them. So just if you feel like you're sick, please come to the hospital, be seen, contact your physician, and we'll make sure you're taken care of.
Awesome. Well, thank you once again, and please let Dr. Hess and his great team know that we're grateful for all their hard work and everything that you've done. So thank you once again, Taylor, for joining us.
Thanks, Eric.